Mhm. Welcome, welcome to those who are waiting. Hello, hello, everybody. Kindly come in, come in, come in. Yes, I can see two people in. Welcome here. Thank you so much for joining. Thank you. Yeah, I'm not going to take our time at all. So, please, if you drop your chat, I'll be able to see your chats and I will be able to respond. Yeah, 10 times better. Thank you. Thank you, thank you, thank you. Jesus will make all of us 10 times better in Jesus' name. Good evening, sir or ma. Welcome here. So if you have any questions, drop them for me. Otherwise, I will just start responding to the questions I've had on the platform. Thank you, Mr. AC. God bless you. Welcome here. If you drop your profession for me, today we want to actually deal with the health promotion officers, majorly our community health extension workers, how they can get themselves to Australia. But then besides that, we can still do more than all that. So you can ask your questions, even if you are not a community extension workers. I'm so much interested. Motivational Will, thank you for being here. I know that name very well. Thanks for all the support, always giving me your shoulders to lean on. Thank you for the maximum support we've been enjoying from you. Yeah, so for like 11 or 12 years that we've been coming together, you've never disappointed, sir. Thank you so very much, sir. So I know it's a bit tough for our friends who are community extension workers to actually get the grasp of how they can travel outside Nigeria or maybe other countries around the world. That's why Akins TV took the pain of checking out with some people who have been in your shoes and they've gone through this journey and it's actually working beautifully for them. And so yours will not be an exemption by God's grace. I want us to, there's no job that's when they are paying your bills that anyone can call an undignifying job. So there is dignity of labor in everywhere we find ourselves. But I want us to shift our attention a bit from thinking HCAs, like healthcare assistant alone. That's not just the only thing you can do. It's not bad, it's not a bad job. I have nothing bad to say about it at all. So far, that job is putting food on your table, you are paying your bills, uh, you are happy doing what you are doing, you are putting smiles on people's face, then it's a beautiful job to do. And I can only pray for success for everyone. But I want that paradigm to shift from just thinking that it is care assistants alone. No, it is just care assistants. And you are seeing other professionals, people that have gone to schools like you, and you are reasoning, what can I do? And you think it just ends there, it doesn't end there. And so for all our community health extension workers, this is a big, big hope for you. If you can do it, it's quite capital intensive, I know. And looking at what our money is in Nigeria, I know it's not easy, but then nothing good comes so easy like that. So if you can invest some funds into this and you do it right, that is why I want us to talk together so that people don't just push big money and nothing will come out of it. So community health extension workers, why did I invite you? I invited you because a friend of mine who was in your shoes, who attended health technology and studied community health. Then after then, she went out and studied health education, then moved to the master's level and studied public health. She assessed for this role some years back. She got it right. She's there down under and enjoying every beautiful thing about it there. So I was just reasoning around, what can I do for my people? And it came to mind. Then I went on ahead to Australia migration platform, and I saw that they are assessing and they are still nominating people, and they are not just nominating people, they are nominating people on state level, on regional level, and employers are nominating people. Then I said, oh, yeah, it's something my people can do. And if you do it, get positive assessment, because that's the main thing when it comes to this Australia journey. If you can get positive assessment, then you are almost like 70% done with the journey. So listen, please listen very, very carefully. If you want to take this role, you must be someone who plans care of people, maybe people who are living in possibly residential homes, or people who are in the communities. You are looking after people in the communities. You are planning the cares they need for them. If there are outbreaks of disease conditions, you are one of those people that are able to target those disease conditions, that are able to quickly identify them. Then you go out, you print flyers, you bring people to the marketplace, you do health education for them. If that is your role and you have academic papers to back it up, then it is what you should do. But now, let me tell some people, because there are some people who may think, oh, we do this because in those days I used to do, yeah, we do this, especially in welfare clinic. We assess people, we plan cares with them, we go to for home visit, because those are the things community health extension workers do. We go to communities, and I felt, oh, as a nurse, I'm fit. By the time we did consultation with VETASES then, which is the body that is going to assess this case, VETASSES, that's their name. So when we did a consultation assessment, in that video that I did, I mentioned that people should do consultation assessment. Sister Nike, thank you very much, ma. You will actually get the recordings if you can't listen, but it might be good if you are able to listen and ask your questions so that I can respond to you directly. So we did that consultation then, and I think it was 210 then. I think I saw it as 245 now, which I believe was still better than for me to invest then. It used to be 800 Australian dollars for that assessment. I felt it was better for me to have an insight into whether I will get a positive assessment and possibly get it, than to lodge on ahead into paying 800 and then get negative assessment. And lo and behold, by the time we finished the consultation, we knew that if we had assessed, we would have failed that assessment and had negative assessment. So what you guys are doing is big, is huge. So start seeing yourself as successes already. So those roles you play, go to the community, visit people, bring people to the marketplace, do health education for them, print flyers to tell people about cholera outbreak and all those things, the prevention, go on television, go on television, go on radios and announce about using iodine to prevent goiters. Those are the things they call health promotion. You are doing preventive works. And that is why someone who is a nurse on the ward will get a negative assessment, because the idea is that they are not supposed to be outside there. With what our curriculum is, with the way VETASES sees the curriculum of nurses, it is not the same role. So if a nurse is here and think, oh, maybe I've studied, I was in community health extensions, I was in EdTech before I became a nurse, and you push in your application, you are not likely going to get a positive assessment. So please, if that is you, don't put your money into this. I'm not among those people who want you to waste your money, because if that money goes outside your wallet and go to the wallet of VETASES, it's not benefiting me, it's not benefiting you. Some family members are even fasting and praying because of that money you are spending. So please keep your money inside your wallet and let's channel it to another side. So, but if it is you, you will do that assessment. If you've gone to that school of technology, and after then, maybe you've gone to the university and studied health education, even if you haven't done public health, you are good to go. If you've done CHEW and gone for CHO, please, if you haven't done health education or health promotion or public health, don't invest your money into this. It's not going to benefit you or me, because it benefits me when your assessment goes to the hands of vet assess, and in 5 months thereafter they bring out your report and it is positive. I will be very happy. I don't want anyone to get a report and me, I'll start feeling guilty. So if you've gone to that CHEW program, you've done CHO, you've done public health, or you did not even go to school of you didn't go to technology or whatsoever, you just went to the uni and studied that education or studied that promotion or studied public health, and you are working in all those areas where you have to be doing all those health promotion works, like possibly maybe you are working with an NGO. I know of this of some NGOs, like all those HIV AIDS something something, SFH, Society for health something, like for family health, something like that. Then there is this FHI, is it 360 or whatsoever, and some other companies like that, NGOs, especially if they are sending you out maybe to ID camps and or internally displaced people's camp and all those places where there could possibly be disease outbreaks. Or when you finish your programs, they send you to a particular village. This is now the time that people who are working in the community should know that they are very, very fortunate to be in those communities. And you are doing all those things in the community, because in the community you are not bringing knife now to open somebody up that they want to have CS. Even if anything like that is going to happen, they will transport them to the hospital. That is why a nurse is not a good fit for this, because that is our jurisdiction, is to be doing those majorly curative parts of health work. But these people, their major work will be to go into the community, prevent, monitor, report, research, audit. Those are the things you are doing. Of course, we have our own part too, where we monitor, we research, we audit. In fact, major, very, very big, but there are some very big disparities in what we are doing. So if these are the things you are doing, you are fit and you've had those qualifications we've mentioned. What will you now need to do? You will need to gather your documents. Australia is very, very, very particular with your documents. So read my lips very well. Everything I'm saying here, jot them down. Go back to this live, because it's going to be alive on the platform at some point. If you forget anything, go back and listen and pen them down. You will need your employment letter, the time you started your work, you will need that. Your manager, or whoever is acting as your manager, the person you are reporting to, we need to supply your reference letter. Your reference letter must state the date you start your job, must state the hours you work per week. So majorly in Nigeria, most of us work 40 hours per week. Of course, some people work 30 hours. So for you to be able to actually assess these roles in other parts of the world, some people work 24 hours, some people work 18 hours. For you to be able to get a positive assessment from this role, you must be a bachelor's holder in any of those fields that I've talked about. So that is why someone who has just gone to health technology school and haven't moved further, you can't do this. Please don't do it. Oh, don't say Mama Loti was you. It was Mama that pushed us into this. I don't push people into problems. So, but if you have all those things we've talked about, or maybe one of two of them, then good to go. Thank you, Uncle T. I can see you. Thank you so much, Mr. Faith. I appreciate you, Uncle Zach. Thank you so very much. I appreciate all of you for being here. Yeah. So your manager will your letter, it must be a letter on a letterhead, that reference letter. So it must be there. The title of your role should be there. Okay, Health Promotion Officer 2, Senior Health Promotion Officer, or something like that. You understand? So it must bear something related to what you want to assess for. And stating the hours you are working per month, per week, which we said must not be less than 30 hours per week. Then we'll now state your roles, the roles you are doing. Now, these roles, VETASES put them out there. What should be in your reference letter? You will not now go and copy them verbatim. That is where your power of English will come into it, or the power of, it's not you, the power of English of your manager will come into it. You will have those roles. You can just go and look at them. VETASES make it possible for you to look at them, and you can now tweak them, coin them in your own words. That is, IELTS will help you in this sense. I don't say you should go and book for IELTS, but if your English is not sound, please, you will need to get to know how it must be sound, for at least for this particular reason. So you can paraphrase those roles that they've put out there, the responsibilities you must be performing. You can rephrase them. You can say, okay, maybe they say that should be someone who monitors activities in the community. So you want to now, when you want to say your own now, monitoring, you will now use word like monitoring of community-based activities, community health-based activities, monitoring of community health promotion-based activities, and things like that. You've changed the word must monitor to monitoring. So something like that. You should be able to paraphrase and rephrase them so it doesn't look or sound monotonous to whoever is reading it. All those lists are there. I put them on the platform for you to have a look. Besides putting on the platform, on that link that I sent with the first video, the link is there. If only people can click. If only people can click, the link is there. So your manager will now put their email address. Your manager will put their phone number, because sometimes those people will want to ring them to confirm things from them. And this is not, I don't want my manager to know. If you don't want your manager to know, if the assessor wants to clarify something and call your manager, and your manager does not know what to say, that person will get a negative assessment. So this is what, when you want to do, you will explain in toto to that person who is standing as your manager. Please, and this is not the time to go and use your enemy as manager. Even if your manager has been your enemy, this is the time to go and buy ọtí olówó ńlá, like the one Aunty Tope Alabi sang about, so that our tummy will be sweeting because of you. She will be so happy to be blessing you. This is the time for you to know how to stoop to conquer. If your shoulders have been like this, maybe your husband is a soldier man and you have always been doing gra 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 for your manager, and she has been looking at you. This is the time for you to go and defeather yourself and be humble, so that you'll be able to get what you need. At least now that you need that thing, you should be able to call everybody, but I know your manager it's not your malu. So you should be able to stoop to conquer. And I really don't see reason why people should not be good at work from day one, that you now start running koloba, helter skelter because you need something. Because if you've been good at work, many people will be very happy to do so many things for you, to go the extra miles for you. So this is where we bring the Omoluabi into it. You now go to her, because their day is our night. Their night is our day. That your manager, if you don't inform them to keep high and keep their phone alert for those 5 months that your documents will be on that person's table. If they ring them and they do not pick, some of them will ring 2-3 times. The moment they cannot get them to discuss with them, then the person gets negative assessment, especially if they want to confirm something essential and they cannot get that information. Uncle Bam Bam, God bless you. I just finished my BSc in education. Is it health education or is it just any education? If it's health education, fine. But if it's education in relation to another thing, I think you can access as a teacher, but you actually need years of experience. So if you've just finished, Except if you possibly have been working, maybe you've gone to NCE before you went for your BSc, then you'll be able to push those experiences. Otherwise, it's not going to fly. So please. And sometimes some assessors will reach to them through their mail. This is not the time for your manager not to check mail. Oh, if your manager does not know how to check mail, please go and teach them and be on their neck to be checking their mails for you. Be on their neck every night when they want to go to bed to help you put their phone on speaker so that when the phone rings, they can pick. I'm telling you this because I've seen situations where a case officer, this person has even got to a stage of visa. And by the time we just sat down and reasoned what the person who was calling from Australia wanted to do, we knew that person wanted to give that person the visa. But this demonic supervisor will not pick. The day he picked, he was just talking to that person anyhow. Like if you ask him for A, he was giving him K. I don't know what the person did, what that guy did for that man that time. And eventually now came to him and said, hey, someone called me. Someone who's been expecting call from Australia was now telling the person who begged him to keep tab of his phone and the activities there that someone called me from Gambia. Something. The person was even talking as if he was from Gambia or something like that. You understand? And they deny the person. You don't want to joke with some things because as beautiful as Australia is, their case officers, their for assessment and their visa officers can be very, 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 I won't say terrible because they are doing their jobs. They just want to be sure everything is correct. If everything is right, I've seen people getting visas within 9 days after application because there was nothing to quiz, there was nothing to question, everything was set. I need this. You know, they carry their what do we call it, checklist. Okay, what is the name? Name should be there, name is there, tick. Shoe should be there, shoe is there, tick. Cap should be there, cap is there, tick. That's the way they work here. The moment you tick all the boxes, there's nothing they want to prove against you. They give you. But in Nigeria, we see it. One agent will be using our money to be eating suya. The agent that doesn't even know 1/4 of what I know will be using your money some people's money to eat suya. I mean, I will be shouting here. People will not listen. Please listen. Or people will say, the talk is too much. I don't know how to summarize. I'm sorry. I wasn't taught how to summarize. So please listen, please. Because you can help yourself, save yourself. There are migration agents that collect as much as 4,000 Australian dollars. So if I'm sparing my time and my data for you, please do the bit of spending your data. Don't say I talk too much. Everything I say, there's no way I say it. If it is long, I know it's because I want you to gain something from what I'm saying, especially because I've had 1 or 2 experiences or my friends have shared 1 or 2 of their experiences with me. So your manager should be able to defend you. And sometimes if they are comfortable with what you've said, they will not even ask your manager anything. You'll be very fine. Now, you will need pay slips. Let me explain these pay slips things to you. The way Australia calculates points for migration depends on your years of experience, the age you have on your head, your English test reports. Some people might probably need that. Virtually everybody will need English test reports, but some people don't need to gain points from English test report, from English test. Your qualifications. If you've gone to school and you have first degree, you are most likely going to get 15 points straight for having a degree. And this role we are talking about is a degree-based role. There are some roles that even if you've gone out to learn them as trades, like hairdresser is there on this list. Now, hairdresser is there. There are people who did not go to school to learn the hairdressing. They learned those jobs and they got their certificate and they went to the Ministry of Labor in Nigeria and they got trade test certificate and they have been working and they are paying taxes. Those people can access like hairdressers because it's there and it's been nominated by the Federal Authority of Australia, Federal Immigration Australia. They are nominating that. Their state is nominating it. Their region is nominating it. Employers are nominating the hairdressers that some of us will be miming for them when they are going everywhere. She did not go to school. All I meet when they are second twin has got PhD. She's hairdresser. She's hairdresser. These people, they value the dignified labels. So health education might also have my CHEWS. Yeah, that's good to go, honestly. Yeah, that's good. But I don't have my health education certificate. Go and get it. Go and get it, bro. By the time you are done with your NYSC or whatsoever, you should be a very good fit for this. Now, you will need your pay slips, like I mentioned. So those who have been working and are not collecting pay slips, it's time for you to go and tell your employer to print your pay slips for you. You will need at least, I will suggest you take at least 2 pay slips in the beginning of the year, like one in January, one in February, then take one November, one December of each year you've been working. Now, your years of experience will earn you points. Please don't throw away any years you've been working when you've been doing this, especially the last 10 years to this time. Now, listen, why this is important is if you said to VetAccess that you have been working for the past 3 years, any labor, any work for this Australia work from 0 to 3 years of practice is 0 points. So if you've been working for 10 years and you are only able to supply your information that, like, they gave you the letter, the reference letter, they gave you the employment letter, you can attach your promotion letters so that they can serve as proof that you are working. But you cannot produce payslip for more than 2 years. That's 0 point for your years of experience. As big as I am, when I was to do mine, I produced my pay slips from 8 years backward. That was when I was able to score 15 points. So if you have been working for 3 years, between 3 and 5 years, you score 5 points. You should be here with your pen and paper. You score 5 points for that. If your experience is 5 to 8 years, before you clock 8 years at work, that is 10 points. Once you've clocked 8 years at work, they will give you your 15 points. Australian authority will not appreciate any assessor who say, okay, she's coming from a third world country, she's coming from a third world country, and let's reduce the years of experience. She said she has 8 years of experience, let's cut it to 3 or 2 or 4. No, they don't do that. Before they used to do it, but I think they've had a meeting about it or something, and they've communicated they should honor people's years of experience, honestly, and it's worth it. So don't throw away any years of experience you've had. You must be able to show proof for those years of experience through your payslip or your pension statement or your bank statement. These are the evidences you will need to show to that assessor that you have been doing this job. For those who are not health promotion officers, who are not CHEWS, who are here, if you want to do this, please, or you have a friend or a brother or your spouse, because sometimes some people are not fit for some things, it's their spouses that are fit. That would be, let's assume someone is an hairdresser now, and you are here as a CHEW, and you don't have, like my brother, I don't know whether this Bam Bam is a man or a woman, but your spouse is an hairdresser. They have their company, and that company have online presence, and they've registered their business. They have the CAC, the incorporation certificate. They are paying their taxes, but you now, you just finished and you don't even have your certificate yet, and your spouse wants to assess as hairdresser. You can pull those things. The moment they get their registration, they get the assessment positive, then you come around, all of you will apply for visas together. So some people, they are not fit, but their spouses are fit. So everything I'm saying, hold them tight. So pay slips I've mentioned your bank statement. You can print January, February, then print December and November. You will need to show those evidences that you are progressively at work. And it's not just for 1 year, it's for all those years that you are telling VetAccess that you've been working. So those of us that used to take our pay slip and trash and go to accounts, go and befriend them in their account to be their friend, let them print your pay slips for you. You need them now, at least two at the beginning of the year, 2 at the end of each year that you've been practicing. It's going to help you. Or if it is your pension statement, you can approach your pension supplier that you need your pension statement. They should give you from different years that you've been paying to them, at least backdate for the past 8 years, that's fine. Or if it is your bank statements, you can take those bank statements, you can print. I just printed my own from my own account then when I printed here. So I didn't approach them at GTB. I just went into my app, login. Then I printed everything and I push out to them. You need those things to help your assessments to pull through. Your employer normally should have an online presence in most situations these days. Online presence, I mean possibly on Facebook. You will see most of these people go outside and even type Vetaccess on Facebook. You are likely to see them there. Type it on LinkedIn. You are likely to see them there. So you too, your place of work should have an online presence. Worst case scenario, if they don't have an online presence, then their their letterhead should actually have workplace email. I know Naija lags behind in many of those things, but these are the things that will make life easier for your assessor to give you positive assessment. So when you can pull all these things together, then your continuous professional development certificate, you'll be attending once they are sending us to go and do courses. All those courses you've been doing, they send you from Osogbo to go and do one course in Abuja. You spend 3 days. They sent you from SFH in Ibadan. They say you should go for a particular conference or a workshop in Port Harcourt. The certificate, you need all those things because those are the things that we say that you are continuously improving at work. If you've not been doing those things, or they've been sending you, you've been dodging. You cannot leave your wife for 2 days. You cannot leave your husband for 3 days. I don't know how you're going to do it if you say you're at work for the past 8 years and you haven't done any training. They would think you are not improving yourself, and you can't prove yourself that you are very good if you are not improving, because many things are changing. It's not the same. So in these past 10 years, 15 years, we've seen SARS in all over the world. We've seen Ebola in so many places. Then COVID came. In fact, my sister said that my sister, who is your friend, who is your colleague, who was a CHEW and took this pathway, she said anyone who wants to actually design even their like your reference letter that they want to design now, your CV, and it's not stating anything about COVID-19, you are not likely going to have a positive assessment, because that is a big pandemic that touched everyone. Was anyone here that was not touched by COVID? I don't mean that you had COVID though, but did it not concern every one of us? Were we not all locked down? Should you not be doing health education in those days? How to prevent, how to notice, how to note the signs and symptoms that you should know what to do, and little things, all those things. So when you are doing, because your CV too will join whatsoever you want to do, your CV must go in line with what your manager states in the reference letter she's giving you. You are not going to copy and wear things word for word. It's not, whatever is a number 1 could be your number 4. Whatever is a number 10 could be your number 2. And you tweak the English. That is how you can get this positive assessment. Now, this assessment, the body that is assessing, which I told you is Vetaccess, they say if you submit your document, if you are not fast tracking, they call it priority processing. If you are not doing priority application, you pay 1033 Australian dollars. That's 1,033 Australian dollars. Whatever that will be today, let me just give us an idea from, I will convert to pound, from pound for pounds point of view, 1,033 AUD to pounds. So it's like 537.69 pounds. And last time I checked, I think naira to pound was like about 1,700. So this is not the kind of money you just want to go and pay without preparing, without tightening your documents. Your documents ó gbọ́dọ̀ tight tán, kó pure tán. So let me just say it's 540 times, as at today, naira to pound came to 1,700. It's very big. It's almost 1 million naira, 918,000 as of today, but if God breathes on naira and it improves in strength, we may end up having it cheaper. Please and please and please and please, if you want to do this, ensure that all those documents are there. Ensure that you describe your role, your responsibilities in line with what VetaSense is saying. I will copy it and paste it on the page there. I will give you guys a prototype of, maybe I should not even give people, because I don't want people to go and copy, because if people are copying verbatim now, it's going to be a very big problem. But I can give suggestions on how you can design those your CV, just so that it will go in line, to be in line with what VetaSense wants. And I can put a prototype there. But if people go and copy, and 4 or 5 people are copying, and everybody copies the same thing, these people will just give negative. They will start issuing negative to people, because you cannot come to me. It is the same English I speak that Uncle Zach will speak. It's the same that Motivational will speak. It's the same that Uncle Philip will same Oyinbo. Like the 13 of us now saying the same Oyinbo is not, it doesn't sound reasonable. So if you are happy for me to put it on the page, I will put it, but you have to promise me that you are not going to go and be doing copying, because it's there for you to work with. VetaSense put it out there for you to work with. So when you are done with all those things, VetaSense say if you are not doing priority processing, your reports will come back in 5 months. That is if they don't need extra thing from you. And in those days, people used to send everything Korea, but God has made it now. These days, you can just email everything, upload when you are filling your form, upload, which makes it much more beautiful. All right, Uncle Zach, we'll put it, all right, we'll put it out there. So we put it out there so that people can have an idea. So, but if you have your money and you want to do priority processing, in addition to that 1,033 Australian dollars, you will be paying another 800 plus. You will add it to that 1,033 Australian dollars. That was why I said on that last video the other time that it's like almost 2,000 Australian dollars. Please, if you are not able to gather your documents, don't go into this. So, because me sef, wey dey abroad obodo oyinbo like this, if I pull that kind of money out, if the assessment does not come out positive, I go run blood pressure. I don't want wahala for anybody, because it's really not easy to make money. Here, you can't even make that money in a month. You will struggle. You will have joint pains, because you have to go and walk up and down, do so many things. We don't want anybody to have troubles with their assessment. If you will not be able to gather those documents, please don't. And if you are a CHEW, you've been working 10, 20, 30 years, you don't have any of those additional qualifications, please don't assess. If you are a nurse and you are working in community area, or a doctor, doctors do work in community areas, and you haven't left that job to study your public health and be working in areas that they do all these things that the community health extension workers are doing, please, this is not what you should assess for, because it's going to come out negative. I don't want you guys to come out back with negative assessment. That money is huge. I know it's easier for people to think about HCAs, especially if UK is bringing them with. If you can take that pathway, that is fine. If you come here, you can start looking at that Australia to your health promotion that you want to do. But if you don't have means of getting in as the HCA, this personally is what I will cancel that you guys should do. I wish you all good luck. If you are doubting what you want to give them, I talked about the consultation assessment support. You can do that. They have two supports they do. There is one they call document gathering. That document gathering, I don't even see Atutu. It doesn't make anything to me. You just gather your all these documents we are talking about, and send it to them, and you pay like 145 Australian dollars for them to just look at it. They will just look at it, none, and say, okay, this document is okay, this document is okay, this document is okay. They will not give you the report that without this document, you will get positive assessment. Because even with all those documents, people can still get negative assessment. Like if the person now gather all those documents, payslip, years they've been practicing, pension, and all those things, but they are nurses. They are working in the hospital. In fact, they are working in the theater. They are working in ICU. But because they studied public health, they felt, okay, I'm due. The person will come back with negative assessment. So I don't see to that document gathering, document gathering support, I don't even see anything there at all. But for consultation, when you guys come to the WhatsApp, I will tell you something about that consultation, how you can get that consultation done. So that consultation is 200 plus, but to me, I think it gives me much more rest of mind to see that someone talks to me. They will talk to you for 30 minutes. You will have sent your documents ahead. With this consultation, you will send your document. It's like they are doing two in one thing now. They will look at your document. They will look at the CV you've sent. They will look at everything. They will now schedule a call with you. And that day, by the special grace of God, may you not sleep and not wake up when your phone is ringing. Because they will ring you, they will talk with you for 30 minutes. You will discuss the roles you are doing, your responsibilities at work. If you are smart, you will be able to decode. Now, let me tell you my own experience. I was working in main children's ward, and we used to have children that were picked from the roadside, the homeless. So we had that child that was picked as an homeless child, and we were looking after the child. And I think for like 5 or 6 months. In fact, at some point, we started picking that child, taking the child to school and bringing the child back to the ward to sleep, to bath him, to do everything for him. So I felt, okay, yeah, but these are the things they want residential care officer. That was what we wanted to assess for then. Residential care officers these days are being assessed by Aqua. So we come back to that later. Those people I talked about, social workers and all those things is somehow part of this. So if you have people like that, you can bring them in later. So I felt, yeah, that's what we are doing. And of course, we used to have many of them then in Wesley. Can I ask a question about traveling to UK? Yes, sir. When I'm done talking with, please ask. I will give response as much as I can. Oh, you will need your transcript. So please, it's your transcript. Thank you. Your transcript from school, because that is what we tell them what you've been taught. You need transcript. Please, you need your certificate, your degree certificate. You are not sending original, you are scanning and sending to them. So you need all those things. You need your international passports. In fact, I'm sure nobody is thinking that I should tell them about needing the international passport again. If you're on this platform, I would just assume that you know, or you actually have your international passport with you. So, yeah, please ask. Any question, please ask. You drop it there, I'm going to respond. So you ensure that all those things you put together are intact. Now, we were taking that child to school and we felt, okay, we were good. So when it was the night, they will call. I was at work on that ward, still taking care of that child, and we were talking. Good evening, Auntie DA. As we were talking, I'm trying to shorten all your names so that all the village people, because when this comes, it won't show your name on the platform. It won't even show all the questions you were asking me, but that's why I'm being very discreet with your names. As much as we want people to do these things, we know they are village peoples, people everywhere. So as we were talking, Sister EF, welcome here. God bless you, ma. So as we were talking, and we were like, yeah, they live here. We take them to school. And the woman was like, maybe unconsciously, was like, who Do you mean someone stays in tertiary hospital for 5 solid months and they are living in tertiary hospitals? Because it doesn't sound reasonable. It was when we came here and we started seeing the way they take care of their people that we actually knew, oh, residential people. The moment you finish taking care of them, if they can't go back to their own houses, then they go to residential homes. There will be people that will be looking after them there. The residential home is like home to people. Some people are living in just their own different rooms. Then in hospital, if you've gone to UCH Clinic, you see we just divide the beds by screen. Some of their wards are like that here too, except when people are in the maybe isolation rooms and you are just in a room by yourself or for whatsoever reasons. They are just like that. You may be 3 or 4 or 6 or 8 in rooms. So she was wondering, well, how possible will somebody will be living in the hospital for 5, 6 months? The moment she said that, okay, we knew that if we go on ahead into that assessment, we just get negative assessment because it wasn't like what residential homes are like. In most residential homes, these residents will be in their own personal room. Worst case scenario, some people are maybe 2 in their rooms. It's not like from one bed, 2 bed, 3, count from the left hand side, bed 1 to 8, then from that end you now count 9 to 16. It's not like that. Yeah. I'm a public health nurse working in primary health center in Saudi. Please, what pathway can I use? I also have BSc. It's your public health nursing, ma. If you just let me know whether that's a yes or a no, that could help me. Or is it public health, like real public health that you've gone to school to do? If it is real public health, I will say do consultation assessment so that they will not go and say your first education is something. If it is public health nursing, kò lè work. Ṣẹ̀gbọ́n màámi, but there are pathways for nurses to get to Australia. I'm a nurse and there are so many other nurses and we know the pathways. So we can talk about that. You can reach out to that email address that I put in that email, ibukunojo21@gmail.com. Is in that message that I sent out that brought us to this meeting. So now I have this 10 times. Is there any hope for health assistance? Now, let me say something about healthcare assistance. Australia, I'm sure many of us are on so many platforms, YouTube's. I just jumped into YouTube not long ago. I've been a migration crusader since as far back as 2015. So at least if I've not been on YouTube, I can say so many things about migration into so many places, maybe possibly than some of those agents that are cheating people of their hard-earned money. Let me chip in this. Sometimes in 2023, some people in Ibadan, they sat down in one carton, one chocolate room, and they started defrauding people of hard-earned money, collecting 4 point something million naira from people to come and travel to Australia. They were giving them fake papers. If you are on this platform and an agent deceives you after all we are doing here, I have nothing to say. It is well with your spirit, soul, and body. So please don't go and carry your money and dash to agent. Just follow what we are doing here. You can do them on your own. We call it DIY, do it yourself. You can do all these things yourself. Worst case scenario, if you need help to restructure your CV, we have people on ground who can help you and direct you to, okay, write this, write that. You can pull this out, you can pull this in at considerable amount of money. But for you to now go and put 4 point something million and throw it to someone and they give you a visa that will not be in existence, and even if you want to push that thing further, they will just give you ban. Careful, please. Careful. I know there are faithful agencies there. If you are bent on using agent, because some of us are quite busy and God has really blessed us, we don't mind. Come back around. We can act as your agent. I'm not doing agency work, but we can act as, and I have people that we do things together that could help to guide you at a sensible cost that you not even pay 4 point something million. Now let's go back to that. After getting Canada or visiting visa or UK, how easy is it to change it to working permit over there? Now, I learned that you can. I checked on Choco Millionaire. I just saw that caption. I didn't even watch the video that someone was able to change their Canada visiting visa to work visa. I don't know how that works in Canada. Until this new, all these changes. UK has been changing like chameleon. They are changing. They will change their cloth to green tomorrow. They will change it to red, and within 2 hours they will change it to black. They said they don't want students to bring family members. Everybody started withdrawing their money. They are now crying. Their schools are crying already. Like child that you take their puff away from them because they know that thing is going to hit them below the belt. So UK said before the new changes, if you are on a visiting visa, you cannot legally work and collect money. But with the changes, UK said you can work for 1 month and be paid, which doesn't make sense to me because I don't know how much you will be paid. That is not even enough to book a BA, or VA back to Nigeria. Doesn't make sense. But that being said, when you come to the WhatsApp platform, we can discuss those things. There are things that we can just discuss by typing, like not taking people's time like this. I cherish all you guys' time, but is it advisable to do that at all? How easy is it to change it to working permits? UK is not easy. They say you can work for a month on your visiting visa. You can hold on to that and get that 1 month to work. But anyway, the visa application is not so much, but even the flight fee is big. It's big. Uh-huh. So, by all measures, I would just say if you can push a permanent residency to any country instead of visiting up and down. Some of us never visited anywhere. We got our visas without any headache. That the first visa that we enter my passport was the one I applied for. Okay, I visited. I remember I visited Cotonou. and I did and I did the photo beside the beach and I said I traveled out and my orgasm went, hey, started to travel out. When I go, we bolo till actually there. Mo lọ Benin Republic. Oh, pé irú ọmọ wo lélẹ̀? So that one did not even enter my passport. I'm not even sure I had passport then. I just crossed. We just used like to cross border and came out and do whatever we wanted. Of course, we went into the interior, we went to the capital, we did so many things. Went to Porto Novo, went around, went to their head, the Abuja of Cotonou, like their state capital, their national capital, whatsoever, capital territory. We went there. But you don't actually need it. You don't need it. There are many of us that the first visas that entered our passports were either the permanent residency visas or the work visas that we got, except if you have the money. Of course, if you have the money, there's no harm in enjoying your money, but not with the motive of going outside that work. Ó tán lẹ́nu, ó kù síkùn. Tá a bá dé kọ̀rọ̀kọ̀ndù wa, a máa sọ yòókù. Ìṣe gbogbo ẹ̀ ló lè gba orí afẹ́fẹ́ wá. Apologies to those who don't speak Yoruba, but yeah, that's it. What about people who did CHEW and CHO and PGD in public health? Very good. That's quite cute. Please, PGD, PGD, PGD. I think I will have to ask Mama T about this. I'm not sure if PGD will fly this. Why am I saying this? There are some jobs that are categorized as skill level 1. All skill level 1 roles must be degrees. So, but you never can tell because sometimes too, Australia pull, they will look at your resources. They will look at, okay, yeah, she's done this, and they look at the transcript. So all this, someone asked about transcript the other time. If you have attended 3 or 4 schools to get to your public health or your health education or your health promotion, ensure you put all those schools transcripts so that they will have nothing. As someone they are like, they will have nothing to say against you. So let's confirm that with her, please, so that I will not be too sure. And please don't mind me if there are some things I do not know. You know, I'm not God, I'm not all knowing. And it's not expressly my field. It's only I'm just very much interested, and I've seen someone who have done it and got it, and she's not even a small girl again in Australia. She's been there for a while and it's still working. She's helped to guide some other people to get it. So yours will not be an exemption. But Sister ME, let's ask her. I will encourage that everybody here should please get into those email address, send your phone numbers. Those who have sent their phone numbers, we've been adding them to WhatsApp. WhatsApp is quite easy for me to come and read what you have there. I mean, it's easier for us to work as community, not necessarily read what you have. But if someone has done something and it helped them, then they can share. If they don't share with everyone, they can share with those of us who have guided them. They will be able to, if someone is having troubles, we'll be able to say this. And like I said, kì í ṣe gbogbo aṣọ tá a bá fọ̀ la lè máa sá nígboro oòrùn YouTube. A máa yé wa sí later. So I will not encourage you working on visiting visa. Ìyẹn náà, aṣọ tá lè sá nígboro ni. Please, what pathway would be advisable for a chef? Chef was, if this chef, if they have their registration, they have CAC, certificate of incorporation, they have online presence, ensure that when you are doing all your these things, your company or your employer has online presence. I knew I mentioned it. Maybe on Facebook, they are on LinkedIn, or they are on Instagram, or they have YouTube account. That is what they call having online presence. Or if anyone just pop their name on on any browser, you should bring it out. That one, they know that they are existing. You know, these people, they are far away from us. They are like 30 something hours by flight away from Nigeria. There's no way they can see you except those things you present them. Those are the things that will define you to them, that will tell you the kind of clothes you are wearing. And while I'm saying this too, Australia can be very, very strict with knowing you. Let me tell you this story again. I've seen a situation where they used to send out spies to go and be sure that you are who you say you are, and you may not know. There was this very beautiful sister of mine that they sent someone. She's got to the stage of visa application, not our CHEWS sister or another person. I think the sister was either an engineer, or I can't even remember clearly, or an accountant, or maybe someone in the bank. And she was quite young. And she said, someone just came to our office, and she was like, she you know, when you are very young and you have arrived, you are like this. So she said, normal. She doesn't normally talk to people. She doesn't define herself. She doesn't describe herself to people. But then this person came and, oh, beautiful girl. So we can get talking. And they were chatting. And the person was like, but you are quite young. How did you manage to get all these things that you've accomplished? She too now, Omurasi, she now talk. When she finished, she said the lady just appreciated and just said, okay, I was sent by Department of Home Affairs Australia. So it was Home Office that sent that lady to go and confirm. You know, they have people in Nigeria that are working in Nigeria that you not know, and they will come and spy you at work. And you say you are working in that place. It is that day that you have chosen not to come, and you and your oga, you know how you will do it. And she's been coming. You are not on leave, oh, she's come. You know, she would have they would have taken one permission or the other, showed you at the people on rota, and your name has been on rota from Monday to Friday. You didn't come. Next week she still stretch herself to come. You have not been coming because you've organized with your manager that you will not be coming. They can be, I don't want to use the word petty for them, but they can be that strict because they want to keep their people safe. She said the lady just rose up and said, "Thank you so very much, ma. I'm from so." So they said I should come and I've recorded all this conversation. I know in a word like this, it is very wrong, but in our place, it's not anything too wrong. Ṣé alámínà ràn kó lọ ṣe ó dẹ̀ ti ṣe? But God so good because all our details were wọ́n jọra. These people, they want your information to be consistent. There should be consistency in what you are presenting them. Oh, let me tell you, you were not born in January 10, 2021 on one certificate, and you come to another certificate. You were now born on January 25, 2020. There should be consistency. Consistency may mean different English word use, but not that the context will change. The context will be maintained. Lálẹ́ ọjọ́ yẹn náà ni visa ènìyàn jáde. So the visa came out that very night. But she said she felt really bad. That when did I turn to Alatonu like this? And I just, oh my God, I was just talking as if they just put sieve inside my mouth. She said she really, really felt bad. So careful when you are into this, everything you should be doing, do them as you should. Now, gone to the person who is a chef. Just some months ago, all those vocational works were being assessed by VETASES before, and Trade Recognition Australia too used to assess some people like carpenter, bricklayers, fitters, plumbers, welders. You understand? Hairdressers, tailoring. I think they pulled that out some times ago. The person is a barber, is also the person that will be called hairdresser. So those names, they are like unisex role name here. So I still saw hairdresser there this morning, and hairdresser all around Australia, they are nominating them. Chef, they pulled them out from assessment with VETASES, but I think they pushed them to Trade Recognition Australia. I think that is where they pushed them to. There were 7 roles, there were 7 vocations they pulled out from these people that will be assessing our health promotion people, and they pulled them out to another assessor. So that is that. For someone who is now a chef, there are some other things that could, Australia will say closely related job. I saw pastry makers there and I saw bread makers. I want to assume that someone who is a chef is someone who can make pastries. Pastries like biscuits, like make pastas, like make burger and all those things. So I would assume that someone who is a chef is able to do all those things. So it's still closely related. So instead of stressing yourself and be looking for Trade Recognition Australia that the assessment will not come out till 8 months, you can just use your money to buy peace of mind if you have it. But of course, TRA is very cheap. It's just like half of what you are paying to VETASES that you pay to TRA. If you know you still have enough time that you don't mind, you can go and use TRA. Otherwise, let the person assess as a baker. Let them assess as pastry maker. Let them assess as something like that. So if they can pull their, listen now, they will need the certificate with which they learn their job. They will need their certificate of incorporation if they are working on their own, and it won't be a certificate that they just rush to do now. It will be a certificate that has been in existence. So if they are just doing it now, it won't fly it now. I highlighted how they calculate the number of years you have spent at work and how you can convert that to points. I calculated that for you at some points in this discussion. So if that company is just coming on today now, just getting incorporation today, she won't get positive assessment through that company because that company has not been registered before. So if a company is 1 year and someone is now consistency of information, and someone say the company that is just 1 year, they've been working there for the past 12 years, ó ti fẹ́ lọ́wọ́ ọ̀rọ̀ nú. And these are the things that normally The person could have been doing them, but there is no way they could prove it. Maybe the person did not want to register before, did not see any reason for registering. They are just registering now. So it now makes it a bit difficult for the assessor. Assessor will not know. They can't read you. They don't, they knew bits of things are happening, but they can't see what is really happening completely in our own country. So you are the one that should make your game safe. And again, the person should come to WhatsApp group. That place, there are things that could be easier for me to just type than to be talking about. Basically, the major theme here is health education. Is there any hope? Yeah, if it's health education, that's fine. Health education, health education, health education. Maybe I do not get what we are saying. I studied physical and health education in my first degree. It should be fine, because in health education, you go out around, you counsel people, you promote health, you prevent illness. That is what health education is about. And that is what health promotion officers do. You should be fine. Worst case scenario, we can ask Mama T. If Mama T is not, like, if she's putting it on the beam and they are not balancing, then you may just stretch forth and do a consultation assessment with vet assess. But I will want to think in my head that nothing should stop you from getting positive assessment. If it is this and you have your document, you should be very, very fine. You should be very, very fine. Yeah, the email address, I will dictate it now. Is Ibukun what? Jesus, I have promised to serve you. Bear with me, please. Bear with me. So I will dictate the email address so that people can, and let me see if I can type it there. Where? Ìbùkún Olúwa Òjó 21. Ìbùkún Olúwa Òjó 21 at gmail.com. I think there was a place I was writing the other time, or was it that I can't write? Oh my. Oh no. If someone can help me to write that on the screen, is Ìbùkún Olúwa Òjó 21 at gmail.com. Ìbùkún Olúwa Òjó Gmail. Ìbùkún Olúwa Òjó 21 at gmail.com. Please send your WhatsApp number there. The person will just add you to that group. It's easier for us that way. So the chef can access as pastry maker or as baker or something like that with vet access, which is good. But they need proof. So if they are working on that person, the person should be paying them. She should be paying pension. Is either they are paying their taxes by themselves, or their employer is paying taxes on them. That is important. And same way we gather documents for this one is the same way. Yes, Uncle Tokwe, sure, you can join. Very, very much. And let's come to WhatsApp. People that want to get through to me, come to the WhatsApp. We are very much able to say some things there. And please only bring people that you are very sure of to that platform. Don't go and bring someone who will be a spy and be spying us. I will want to assume that everyone that is coming there is coming from any one of you. So if we now have a spy that anyway, we aren't doing anything against the law. But there are sometimes you want to speak in your language, there are sometimes you want to chat, there are sometimes you want to fight. You understand? When we feel there are always sometimes we can fight. And we now bring a stranger into our midst, and they are seeing us as being disorganized. We don't want that. So anyone that is coming from you, Mama T is on that platform. She immediately, because she too, in fact, when I did that video, I guess I'm not sure anybody has really done that video, but it's been on my mind because I have a friend, a very, very close friend that we grew up together, that is in your shoes, and she's done so many big, big things. And I've been wondering, what can my sister do? And I just remember that Sister T did this. When she saw that video, she was just thanking me. As in, she kept thanking me. She said, "Oh, my sister, thank you for putting your voice to this. Thank you so much." For someone, by the time you come, I pray God perfects your journey. There are times you will look around you. You want to see somebody like this. You understand? All those rubbish fake fights we fight in Nigeria. If I see a Hausa person like this, I will. Okay. There was a day I was coming from, the African spirit. I was coming from school. I think my car was with one of my friends or something. And I picked my boy from school. I picked my girl from school. And we were waiting for buses. In our place, buses do not come around like that. We are living in suburb. So the bus that will even come, cuckoo come. Like if buses come every 1 hour, the bus we were just looking at the Pako, the bus don't know why they will not come back. And so the man saw us there. He went to buy something from the store, he went back. After that, he went to another school that was far, far away to pick his son. He was coming back, he saw us there. He now said, okay, then he was going again to pick another person. He saw us. He just stopped. He said we should come. He picked us. He brought us home. He went back to wherever he was going. And I was now telling my daughter and boy that is the African spirit. You know what? And the man wasn't even Nigerian. He was a Gambian. He was just so happy. There are sometimes in fact, many times, you want to see people of your skin around you. Just 2 days ago too, I went to drop my daughter at school. She's told me that someone is in my school. She's in my class. She has my skin color. They are the only dudu amongst everybody. So they are fine. They are looking well after them. They have good friends at school and all that. But some consciously or unconsciously. So she told me that someone like my skin is in my class. And for like 2 weeks, I've not gone to her school. It's been their dad dropping them, picking them, bringing them up. So I just went to day before yesterday. And I saw the person. I was discussing with one Oyibo woman, my daughter friend's mom. And the person saw me, when you see a typical African, there's a way you talk to yourself with your eyes, with your I just quickly finished discussion with her and ran after her. See, she brought me to my house too. We were just talking, and she's not Nigerian. She's Zimbabwean. And in fact, that is just it. So please, this is not something you hide from everyone. From good people. There are people, I don't say go and tell everybody about the effort you want to make now. Bro or sister TF, thank you for coming around. But there are good people around you that should know. Let them know, because I think I saw on a particular page, did they say they need 900 people for this role? All of us on this plan on the channel you came to, the people that have even joined are just 100 something plus. So we don't even have. That was a state though, not the other 7 places. They have 6 states, 2 territories. That was just a state. And this your work is on priority occupation list, is on gold occupation list, and priority occupation list. If you apply for visa, your visa should come out within 15 days. Is it 15 or 13 days? So the major thing there is you getting a positive assessment. If you can get a positive assessment and you have enough points, we haven't discussed point. I will discuss point with us because tomorrow is Sunday, apparently. I thought we just discussed for 30 minutes, and yeah, we've gone too much into like 1 hour plus. Is it true that many dangerous animals like snakes already ẹran ejò, ẹran jíjẹ ni, ẹran kí leléyìí o, ẹran ológbò o. Pepper soup items làwọn yẹn now. All those ones are pepper soup items. For people who are just joining us, you might not know I have interviewed someone who answers Charles Oguntade. If you go online, go to Facebook, pop that name, you see Uncle Charles. Uncle Charles has been there for like 20 years. And when I asked him the question, he just busted into laughter. So he said, the first and the last snake I've seen in Australia was like 7 or 8 years ago, and I saw it in the zoo. So Australia, I won't dispute what you are saying. There definitely will be snakes. There are big animals because that place is too big, like too big. Okay, it's as big as in the same country. Some states are like 3 hours ahead another state in the same country. That is how big it is. After the assessment, do someone still look for job? Mommy, if you are going with independent visa, you just organize, get your visa, get there. You can start searching for job before you go, but you will definitely look for job now. It is if you are going with work visa in most situations that you don't need to look for work. You possibly would have been recruited from your home country. But if you are going with independent visa, then after your visa, you should try and get a job. Worst case scenario, if you don't get a job, get there, you will get a job when you get there. That our sister, when she got there, she got job. In fact, the first job she did was not even actually in health promotion or community whatsoever, but she got job. And she did not just get job, she's very comfortable. Okay? You will meet her there. She will tell you a bit more about herself. She's not a YouTube person. She would have been here because she was so glad. She said, "Sister, you spoke my mind. You spoke my mind. You spoke my mind." When you are working with someone of the same dream, that's the way life treats you. Yeah, thank you. I'm loving yourself. Oh, I've become a seminarian. Thank you so much. After the assessment, okay, I will tell you some things again. But let's call this a Saturday so that we can go and rest. I know you guys are almost 10 p.m. I'm close to 9 p.m. I'm happy to keep going and going and going. But by the time people that are not here come across this, they may not like it. They will say it's too long. But I know such people will sit down and watch the tribe called Judah. They will watch Jennifer. They will watch Alakada. Those ones that will not put their money into their wallet. But this one that is going to affect generation unborn positively. Some people cannot spare the energy to, you know. But honestly, if you ask me to keep going, I'm very happy to keep going. It's what I've been doing since 2015. Go to Nairaland, search for Mama Jazz. You see my name there. I've been always everywhere when it comes to migration. I love it when my people are happy. I love it when my people are happy. Please do these routes have an age range? Yeah, thank you very much. If you are more than 45 years age, it's not going to be, you can still get to Australia, but it won't be through independent skill migration. You can have employers, if they are overstretched and they can't find people, they can give you visa to come. They can give you visa to come, but you will need this positive assessment. Is the catch for Australia. You know, people have been Canada pathway. You will know something called Education Credential Assessment, ECA. So this is like Canada's ECA that you will do with CHEWS, you will do with ICAS or ISS. So for Canada, either you use ISS or you use ICAS or you use CHEWS to do your assessment. Australia now have myriads of assessing bodies. Is much. Is a different assessing authority that assess me as a nurse. A doctor will be assessed by another authority. A physiotherapist will be assessed by another authority. A nutritionist will be assessed by another authority. Something like that. The vocational people are being assessed by these vet assess. So that is them. The tradies, like the bricklayers, the carpenters, the plumbers, the welders, are being assessed by both vet assess and Trade Recognition Australia. There's Engineering Australia. There many. There are those that assess teachers. So you have to identify your assessing authority. Sister T, Swalema. I appreciate your presence, ma. So now let me tell you about how this age affects your visa, your assessment. When you are less than 25 years of age, you will score 25 points in age. Let me start like this. When it comes to age, the way it matters to Australia is that Australia needs you to pull 65 points now. That is the minimum point they are taking. There was a time those points pushed up to 1995 before COVID. But when COVID came and slapped everyone here, slapped all the world nations, the strong countries of the world here and there, they need people after. People were resigning from work, people were having post-traumatic stress syndrome and so many things. People were not working again. Some people died, some people could not cope again, some people became they had some disabilities due to the impact of COVID. May COVID not die well. So it's impacted everyone around the world in huge ways. That is why people like us and you could have some access, because gbogbo kini yẹn ti tight. I will want to assume that many people here can speak Yoruba. Those things were tight at some point, and really, really, really very, very tight, that people could not really get in with ease. There were times people were getting it with ease. The time we just fell on it on Australia, then in 2015, 2016, the engineer guys were the hot cakes. Before you know it, sharp, sharp, they've done their everything. They are moving. Later, everything just went down. Whenever they see that people are pushing too much, they will raise those bars from 65. They will start pushing 70, 80. And for you to get points, let's see how you get points now. The email address, I said it the other time, WhatsApp number in the email to join the group. Yeah, please drop your WhatsApp number. Then the person will add you to the group. She's my kid sister. I may not be able to do it because so many people have dropped it in the email link to the channel, but unfortunately, my hands are full. But if Ibukun picks it, as many as she speaks, she's added them to the group. Please, because those ways, there were some things that could be easier for us to, if I can't say them in English, I can say them in Yoruba, and someone will pick it from there and transmit to Igbo and transmit to Hausa, and we get all the message, and it'll be fine. Now, if you are less than 25 years, you score 25 points for age. Between 25 and 32 years, you score the maximum point, you score 30 points. Take note, if you have a pen, right now, so that you will have an idea of how you can get your 35 points. If you, between 32 years and 39 years, you will score 25. You drop now, because I think they assume that between age 25 and 32, the people are very strong. There is that agility, there is the zeal to go everywhere. I want to become this, I want to become that. You are very career focused. And some people are not even getting married, or maybe they are just getting married at 32 or thereabouts. So your concentration, your energy, your brain is work, is development, is attaining that height that I want to attain. That is it. You should be driven. The person who gave us this platform, who made it possible for us to know that our community extension worker friends can access for this, was pushed like that. Because it was that push that when she finished, I knew in those days, in her days, people were not pushing into schools like she did. But she told me something. She said, I felt that before I turned 40, I want to become, she's a typical Ekiti girl now. You know what we want to be. You just want to be akada, 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 akada. I want to be this by the time I'm 40. So, and she actually pushed really well. So once you clock 40, between 40 and before you turn 45, that age drops to the lowest, drops to 15. So put your age there, everybody, so that you will know. Now, your degree certificate should earn you 15 points. If you are someone who have diploma will give you 10 points. If you have masters, it will still give you the same point that degree will give you, which is, type on the screen. No, if let me know that you are following me. What point will BSc give? Type. I will not repeat it though. If you want to get it, you have to come back and fast forward this video to 1 hour 20 something minutes to get it, because I just said it now. So your MSc will give you the same point that BSc will give you, but PhD can give you 20 points. That is the highest you can score. Thank you, thank you, thank you. People are following me. So, and there are some universities in Nigeria that are rated as Australian Qualification Framework 7, which is what BSc is about. Such unis are like Unilag, federal universities that are teaching 4-year courses, state universities that are teaching some courses at 4 years. If you've attended such programs, then you are likely going to get 15 points for your first degree. Or if you've gone to university, let's even say they are not rated as second tier Nigerian universities, but you've now top up with masters, you should be able to get 15 points. But if you have PhD, you get 20 points. If you have diploma, like someone who's a CHEWS now, that's something like, I believe it's a diploma. I want to think it's a diploma program. I'm not too sure. Then, or you've gone to NDHND diploma program, that's 10 points. And that's the point you will get to if you've gone to learn trade, like that vocational chef person. If they learned it, it's not like they've gone, even if you've gone to NAPTEP to study it, or if you've gone to technical school to study it, you will get 10 points. That is the minimum points you can get. Now put it somewhere. Let's assume you are age 28. You score 30 points from there, and you have your first degree already, and they give you 15 points. Add it to 30. That makes how much? Oh, tap it on the screen. That gives you a particular point. Now, your years of experience comes to it. I said if you claim years of experience, if your year is 0 to 3 years that you've been working, that gives you 0 points. But if you've been practicing for 3 to 5 years, you get 5 points. If you've been working for 5 to 8 years, you will gain 10 points. If your certificate, I mean, thank you, if your experience has been for 8 years and above, you gain 15 points. 15 is the highest you can gain from work experience. Okay? If you add that, let's assume you're able to score 30 points from age because you are 27 years, or you are 30 years, or you are 31 years, or you are just 32, you haven't crossed 33, you score 30 there, and your university degree give you 15 points, that gives you 45 points. If you've been practicing for the past 8 years, that gives you 15 points. Add your 15 points to the 45 you have before. What would that give you, guys? 15 plus 45? 45 plus 15. 45 plus 15. Nobody's typing. I'm talking to myself. I know I'm not talking to myself, so you guys are still doing calculations. Add 15 to that. That will give you 60 points. Another place you can claim points is through your English test reports. Thank you very much. English, we said you have to get 65 points before you will be invited at all, at all. Emma Bamikalo, please follow me in total, because this is very important. I thought it's something we do some other day, but now that you've asked, I'm trying to let you know all you need to know, so that it will not be like I push you into it, but you're shocked. So if your age is very big and you will not be able to get all these points before you turn 45, please don't invest money into it, so that you now not turn around and say, Mama Jazz, no foul. Please, or say mentor, no cause. Please and please and please. So, I think, I'm trying to tap away this sister. I don't know. Hopefully your name is not going to show when we have the video there. If it shows, I may need to edit it out. Sister EF, please tap your name away from the screen, hopefully. So you have that. English test is either you write IELTS, you can write general IELTS, you can write academic IELTS, whichever you prefer. You can do either computer-based, or you do a paper-based test. You can write Pearson's test of English. You can write occupational English test. They also accept Cambridge Advanced English test. whichever one is convenient for you. Before they used to take TOEFL, I learned the stuff taking TOEFL. So, but either of any of those four, you can write and you present. Now, this is how you'll be graded for English. If you manage to score 7 points in or 7 band, IELTS will rate you on band level. If you get 7 band in all those modules, 4 modules, in writing, speaking, listening, reading, then you will automatically get 10 points. Add 10 points to the 60 you have before. You are so brilliant to go to express your interest that you want to come and live in Australia. But if you score 7 points in 3 and you score 6.5 in any of those 4 modules, then that point is 0. So you must push. If you need to gain points, there are some people who don't need to gain points from English. You must push to get 7 points in all your modules. Very, very important. If you need to gain points from English. If you don't need to gain points from English, then you don't have to stress yourself. Like someone who is very young, like the person we've calculated their point to be possibly 60. They score 30 from age, they have 15 from school, and years of experience. That's big, 15, 60. Even if you don't want federal nomination, you can just apply to a state to nominate you. Once a state nominates you for this pathway, the state automatically gives you 5 points. So if the state is able to give you 5 points, then that's 65. You can enter the pool with that. And if it is the time that Angeli in Rumi, you'll be able to, they will pick you. Once they pick you, you go for visa application locuni. So that is that. But if you are so great and you are able to score band 8 in all the 4 modules, I've seen people scored band 8 across modules or 8 and above, 9 is the highest you can score in IELTS, band 9. If you have 8 in all those modules, that is 20 points. So if all you are able to do, let's assume you are old like myself, like this, so tí ọjọ́ ti pọ̀ lórí bíi ti Mètúsélà yìí. Let's say you are 42. You can only get 15 points from your age. Once you get 15 points from that age, and let's say you even have masters, that's 15 points, or the 30. You've been working for more than 8 years, that's 15 points. That's what you can gain for yourself, 45. You need English test to bail you out. You will now need to write English test, at least have 7 in all your IELTS, either general or academic. Australia English test expires in 3 years. It's not like other countries to get 2 years, and I think I give it to them. Same is New Zealand. Both New Zealand and Australia, the English tests expire in 3 years. Beautiful. And they are sister countries. The registration you get in Australia, you can convert it to New Zealand registration without lifting too much of fingers. The one you get in New Zealand, you can convert it to Australia registration, which is beautiful, through their trans-Tasmanian mutual relationship pathway. That's a discussion for another day. So once if your age is big, you really need to push very well and make sure you get at least 7 across modules in your English test. Otherwise, please, if you will not be able to do it, don't push it. Don't say, I'm the one that pushed you into this. Please, please, and please, you can look for other pathway. You can look for your spouse to do an assessment if they are younger than you. Or if you just want to do the assessment, you can do it. Maybe an employer can nominate you. If you get an employer to nominate you, you will not need Wala with all these points we are talking about. But employer nomination is fine. You will have to sign it. OET is acceptable. Thank you. Yeah, I use OET. It's quite acceptable. It's acceptable. It's acceptable. And you will just weigh the point for OET. Like if it is OET now, you must score 350 to get band 7. So at least 350 across modules. If you need just band 7 to get 10 points. Pearson test of English is an exam. You sit down with your computer and you do the test, and you should expect your report within 48 hours. There used to be a place in Ikeja where they used to write it before. I'm not sure it's still there, but I know Bellas is still there in Surulere doing it. And there are some centers, maybe in Kaduna or Port Harcourt. I don't know if anyone wants to go to all those. Port Harcourt isn't bad, but I know I'm not sure there's a center in Port Harcourt. There used to be one, possibly in Port Harcourt before Enugu, I'm not sure. But there's still a center in Kaduna, but there's center in Lagos. So, Pearson test of English, you must score 65 in all the modules to get 10 points, or 79 in all the 4 modules to get 20 points. Now, I was explaining, if you have band 8 in 3 of the modules and the person now has 6.5 in any of the modules, that is 0 points. But let's assume the person have band 8 in 3 modules and 7 or 7.5 in 1 module. That will drop it to 10 points. It's still good. So if you want to claim 20 points from English, you must gone for at least 8 in all your modules, or 8, 8.5, 9 in whichever order you want to have them. So that is the way you can do it. If it's Cambridge, if whichever one you think is good for you, please, whichever one is easier for you, do it, do it, do it, do it. From my experience, I've written Pearson test of English, I've written IELTS, I've written OET. I think I want to think for myself that OET is the easiest. OET seems to me to be the easiest, but that's because it is more of profession directed. So, but say exam tally pass. If with all we are going through in Nigeria, I don't think there is any exam any one of us cannot pass. If you've passed Nigerian WAEC or NECO and you read for those exams yourself, you sat down and passed, there's no exam in the world that you cannot face and defeat. Hold that. So you will get those points. Now let's assume that you are even aged. I mean, none of us is aged, but God has increased you in age. You've grown. Maybe you are 42, you are 41, you are 40. You know your age point has dropped to 15 now. To get those things is a bit of struggle. So English, fine. But if your husband or wife can write English test and have 6 band in all the modules, you can get 5 points from their English points that they've written. So let's now assume that you've made effort. You've done everything you can do, you only get 45. If you want to do this, do your assessment as speedily as you can. Encourage your spouse to write English test. Then if they have 6, you can gain 5 points from them. Add 5 points to 45. Share is 50 now. This is the juicy part of it. If you now ask a region, you will go and now fill an expression of interest form. It is there on Australian visa website. Fill it and say, okay, state so. Fill for as many states as you can fill for, possibly all the states. I want to come and work in your state, or I want to come and work. There is a way you fill the form. Those questions are just dropped down. Some they are dropped down, some you just click and write whatsoever they are asking from you. And if the region nominates you, the other time I said if a state nominates you, they will give you 5 points to add to your points. If you've had 60 before and they give you 5 points, you have 65. That's on that 65. That's what they are using to invite people these days, at least for now. Doesn't increase more than that. But when they want to start closing their door, they will be raising those points. That is why sometimes I used to say, if people have their money, if they can fast track, if they should gather correct document, fast track, because you never can tell for this people. And sometimes, if those works are tedious to get people, they will not raise they will raise points for everyone. You will not see them to raise points for nurses because they are never enough. They will raise points for everyone around the world. They will not raise points. If they are struggling to get people into those works, they will not raise their points like that. So if a region nominates you, they give you 15 solid points. So if all the points you can gather from yourself and your spouse is 50 points, once a region nominates you, they dash you 15 points. And you will now, if you have that 15 to your 50, that's 65. You will be there in the pool, and the state will just say, oh, I want this person to come. I want this person to come. As it is now, for now, New South Wales is the one giving nomination like pure water. Oh yeah. Some other people are using their own nomination as bottled water. or using them as dry, or as what do we call all these ọtí àwọn àgbà that store. You understand? They are keeping them as if they are strong wines, but New South Wales is giving out. That is how you can claim points. So please and please, but if your age, if you cannot even get enough points, you may still be able, with a positive assessment, get an employer to nominate you. If an employer is nominating you, you don't need all these points wahala we are talking about. Of course, we need English test. You just need your English test to be on band 666. Why do you need English test? You have to show that you can communicate. So they will say it is communicative level English. So you need English to, we go there, we'll not be speaking our Igbo, our Yoruba, and Hausa, we speak English. You should be able to communicate when you get over there. So that's why you actually need that little English. But some people are lucky. Those who were able to go to school early and they got jobs early and they are still not really very old. And this one, if you're able to get a nomination, next is for visa application, and your nomination covers all your family members that you want to take along with you, and you go and do medicals and be waiting for your visa. That's how it is. I know there are some questions I haven't seen. There's center in Port. Oh, thank you, ma. If there's center in Port Harcourt, I knew we used to. Did you say visa Australia site? New South Wales. It's not Wales of fish, oh. It's whale without H. So New South Wales, that's where you have some people would have been hearing about Sydney. Okay. Oh, uh, coach the coach. Thank you so very much. Thank you so very much for the support. Which one is irrespective of their? That question is not clear to me. Is it the one I was talking that an employer can nominate you? Employers in most situations will nominate someone that is not yet 45 years. Once you clock 45, the years, the chances are reducing, but there are still some employers, if they are overstretched, they will not mind. They will just give out the nomination. Some employers will not even mind. So it's now between you and the employer, Is anyone with diploma in CHEWS, with BSc in public health, will get the points separately? You know, okay, I see you. Typical Nigerian auntie. You will not get the points separately, please. Your highest certificate gets the points. I believe you understand what I'm saying. So it's not like they will give they will give the 10 points to someone for having CHEWS. And they will now say, okay, she's got BSc, and they will now add 15 points. Okay, she's got PhD, they will now add another 20 points. If it's like that, life is easy. It's not. It's your highest certificate that gets the points. Right? I believe you understand that. Did you say visa Australian visa site? That's their immigration. They call it is it IMI account, or what do they call it? I can't remember clearly. I can put the link out too on the platform. You can have access to it. All these things, just type Australian immigration website. If you do it, it will bring it out for you. So yeah. Thank you. If they center in Port Harcourt, that makes life easier. I don't want people to be journeying down and forth, up and down with what Nigeria is now. I pray God will continue to protect everybody. Oh, it is acceptable. You can now calculate your points and know. Did I see? Okay, yeah. You can now calculate your points and know whether you are ready for this journey or not. And if you are ready, please don't even waste time, because as we are talking, I've seen a day the Australian, was this one engineering site opened for expression of, maybe a state opened for expression of interest. Before you blink, within like few minutes, àwọn ọmọ Paki, àwọn ọmọ India àti kún bẹ́ẹ̀, wọ́n ti lù pa. Sharp, they closed that site. Once Tambade to Wally, once these guys close things, all the things that have been flying around about UK now, they've started closing their doors gradually. And this UK, they have their ways of influencing other nations around the world. But this one is a goal anyway. God has perfected it. So thank you all for tuning in. Thank you for being so patient with me. Thank you for encouraging me. I can only wish success and multiple success for everybody. See you tomorrow. See you soonest. Bring your friends. Come over there. We'll be fine. Thank you. If you have questions, have I answered everybody's questions? As in, when I started working, I wasn't married, but now I say, so same like many of us now. So you put your change of name documents there. UKVI NCLEX is not for this pathway we are talking about. If you are talking NCLEX, you are possibly a nurse and you want to go and work there. That pathway is not bad if you have NCLEX already, but you will need to go to Australia to write OSCE, which is 4,000 Australian dollars plus. They write the Australian OSCE in April, July, September, November. They have 4 months in the year that they write them. And I think they have just few centers. They were just about adding Adelaide sometimes ago. Oh, you want me to come tomorrow? Someone is saying, what time tomorrow? If you want me back tomorrow, I'll be back. I'm not working tomorrow. But you need to give me what do you want me to speak about so that I will not come here and call you. You know, today we were focused, then we started picking questions. If you have your money and if you've written NCLEX before, maybe for Canada, for USA, then you can port it to APRA, which is the body that assesses nurses, many health professionals before you now go inside to assess your skills. So if you want to go NCLEX pathway, it's not compulsory for nurses. It's not compulsory if you are going through New Zealand. You first do your registration with New Zealand, and I mentioned that you can port your registration in New Zealand to Australia through their Trans-Tasmanian Mutual Relationship, and you can do so too for Australia to New Zealand. So you can take that path. And I know a number of nurses, because we've been all out that nurses should start taking those pathways. Some were even fortunate. Some have not even written any exams before they got employers. You know what they did? They just made their CV attractive. Put those CVs on Indeed, put those CVs on LinkedIn, put those CV on maybe Glassdoor. And employers, they were sourcing for people, send them code mails. I knew some people who it was after they got the jobs that they even knew that they needed to create accounts for CGFNS New Zealand to start registration. They did not create account before. They did not even write English. Some people were even about going, and those people helped them. They trained them for English right in Nigeria under our nostrils. And I'm sure I've been shouting about New Zealand registration since 2021. Yet, some people never had their accounts. Yes, some people never even hear. Yeah, we all have things that we devote our data to. So, but if you have your money and you want to go and if you want to do registration straight up as a nurse in Australia, not bad, but for me, I would say it's capital intensive. But I think if I have the money, I will use that money to buy rest of mine. I will just go to Australia and go and do a ski if I pass my NCLEX. But if you haven't passed your NCLEX, you can go and write the NCLEX in Australia. It's 4,000 plus too. So it means you will need to pay 4,000 and something for NCLEX. When you've passed, you will write a scale of 4,000 and something, and you know you will be paying for rent. Australia pays rent every week. They pay your salary every 15 days. So you have 2 paychecks in a month, but you pay your rent, I think, every week, or maybe occasionally some landlords will say monthly, but most of them you pay per week. So you will need to be responsible for your flight tickets if that's the way you want it. You need to be responsible for, if you don't have someone who is hosting you, getting an hotel that you're going to stay in and all those things. If you can bear the cost, I don't mind. I'm very happy for people to please, because the ways someone will take to, the way some people will take to get to a place is quite different the way for some other people would need to take to get to. What matters is we getting to the destination and getting there in perfect peace and having it being very rewarding for everyone. To me, that's the way I see it. And if you are troubled, you don't even know what to do. This is the part I don't encourage. But especially if you have skills and you can go through you have your job you can go through. I don't always encourage student pathways. But if that is the only pathway you can go through, and you know you will finish the school before you are 35, so that you can get post-study visa. If you are 35 and above, you can't get post-study visa in Australia again. No. But if you are below that, you can really get post-study visa. And their post-study visa, I think, is 3 to 4 years. In those years, they expect that you should be able to get something that will make you permanent in the land. If you are going to be older than 35 before you finish your program, please don't go for it, except if you know that that role you will be able to get permanent residency through it. Like if you're going for nursing, if you still finish at 35, you will get someone to nominate you. Worst case scenario, then you do skill assessment and you go through independent skill migration. You convert from there. I brought someone to discuss school pathway because he went through school pathway, and I just love the man, the way he enjoyed the journey. It was tough. Oh, if your kiddies are 18 years and above, they can't go with you. For New Zealand, your kiddies, if they are 22 years, they can still go to New Zealand with you on as your dependents. But once your children are 18 years, for Australia, you can't bring them in. You might just need to go and settle in and look for maybe student pathway to bring them in. But New Zealand, if you know you have kiddies that will be more than 18 years, that will be like 22 years, I will just say, just go through this way. Get the New Zealand whatsoever visa. Then, I know someone when we started this whole journey together, he got Australian permanent residency, but he said he did not want to live in Australia. He just landed in Australia, carried his kaya, and started living in New Zealand. So if you do it that way, you will be able to bring that your child that is not above 22 years to New Zealand on your visa as your dependent. So far, they are not married. Yeah, they must not be married by the time you are doing the application. So that is it. Thank you very much. Tomorrow is Sunday. I would need to, oh my goodness, we've almost spent 2 hours. It seems like I should not leave you, but then I need to go and rest. Thank you, everybody. I'm so grateful. If you have questions, pull your questions together so that I can come back and answer your questions. I'm always very happy. And this is easier for me than to be typing. This is actually easier for me than to even shoot video because I can see your mind. I can respond to you immediately. And if I'm able to respond to you immediately, you don't have to go and be searching and watching all the videos over and over, except if you think that you just need to. Thank you very much. I appreciate everybody. And I pray God to ease everybody's affairs and make the journey easy for everyone. If there's anything you must go home with today, ensure your documents are good enough to earn you positive assessments. I don't want anybody to have negative assessments. Criteria for nomination, I've stated all the criteria for nomination. Your age, your academic qualification, your years of experience, your English test point report, your partner English points reports, all those things are the criteria that will grant you the your nomination. Once you're able to pull 65 points, you enter the pool. Like, okay, when I did mine, I actually submitted, my nomination was submitted like 6 something p.m. in the evening. And by the time I was at work, by the time I was going for break around 12 something in the night, I just received a mail from my nomination officer that same night. So, and she just requested that I should send, she said I should send a particular document. And I just opened my phone, sent it. Before I closed my eyes and opened, nomination was sitting pretty in my email. So I got my nomination within 6 hours. Some people will be there waiting to get nomination 6, 7 weeks, 8 weeks, 9 weeks or more. But for this kind of jobs that they are looking for people, seriously, if you get positive assessment, you are not going to stay too long on that queue before you will be nominated. If you have that 65 points at this stage, you should be fine. And yeah, we'll come back to talk about trade people. I've made a video about the trade people sometimes ago, but I think I need to update some things for those trade guys because I know the vet access is assessing them. I saw bricklayer, I saw carpenter, I saw joiner, I saw so many trades that vet access is if vet access is assessing a trade or anything, I know their money is huge, but I prefer going with them. Because if you have all your documents intact, you are not going to have as much headache as anyone can think of. Pathway is the best for nurses. We'll come back to pathway for nurses. I've made loads of videos for nurses on my channel, on this channel. I've made loads and loads and loads. In fact, I think I just started doing some other things that were not nursing not too long ago. I've been doing nursing. I think I've been very, very like, what do they call that language in research or something like that. So we need to balance the equation now. Can health assistance apply? Health assistant pathway is different. Someone asked me that question. Now, you saw so many videos about health assistance last year. They brought those things up, but the only visa that I saw that those guys are entitled to, I just discovered, I think 2-3 days ago, when I was talking with your Mama T, that it was only visa 494, and visa 494 is for somebody who is already in Australia. So I've seen people who got these registrations done, but I haven't seen anyone who got a nomination, whether by an employer. And it is not even on independent skill. You can't push expression of interest out for it. I want to say, if people have their money, you can do the assessment too. Because we never can tell. Oh, it may be tomorrow and some things happen and they will say, okay, let's spread this, let's extend it to every other person, and they may now put it on regional visa nomination, state visa nomination. Employers may now start taking people from across the world. If that happens, if you are assessment ready, you just present your assessment and they will nominate you. But if you are not assessment ready, then it may not work. At what point on band 5 UKVI will not have any point? I said if someone score 7 and now drops into 6.5 in any of the bands, in any of the modules, the person scores 0. So if anyone has 5, that's 0. Health assistance. So that is what I believe the person who has questioned about health assistance. Then, yeah, you got what I'm saying. You got the information that passed. I've seen assessments came back positive. Assessments, not just one, came back positive, and they were quite fast with them. But then we haven't got people giving out jobs. I thought by now, with the way they shouted it that time, people should have flooded them, but they have not started. But I think maybe at some point they will start needing people. And if they need people, then if the person is assessment ready, but it's a 50-50 game as it is now. Thank you so very much, my people. God bless every one of us, and I wish us all the best in our efforts to make things better for ourselves and our family members. Thank you. Bear hugs to every one of you. I love you. Bye.